speak on the first topic, Introduction of Way to Go. Dr. NILUTPAL BORAH is an excellent cataract surgeon and a retina consultant from Netramangal Eye Institute. He is also, he has completed his MS from Assam Medical College, and thereafter he has undergone a training in retina from Shankar Netralaya, Chennai, and Moorfields Eye Hospital. He also has he has also published a number of papers and articles in several national and international conferences like AAO, URetina, ESCRS, and AIOC. He has also a number of publications and articles. All over to Dr. BORAH, please.
Thank you, Dr. Nilaksi. We have a very thin attendance, so however, we should not despair, because when we start a project, it will always have a thin attendance. We do not expect a new project to start with a bang always. So especially when we start in a underprivileged area, that is suburban areas, or maybe in rural areas or sub-rural areas. So to get into hospital business, it requires extensive planning and a large capital. So it's a very ambitious thinking. And if you plan to have a hospital, so you have to discuss, you have to have a professional personnel and substantial amount of capital. So we can take it that if you have planned to open the hospital, you are a rich man or woman. So to start a hospital, first we have to think, we have to brainstorm. If we have colleagues, we have to brainstorm with the colleagues, or if we are opening alone, then we have to discuss about the project along with our relatives, with our friends, and with our colleagues. And we should write down the project from the beforehand, and what we are going to do, where we are going to do, how much investment we are going to do, what are the equipments we are going to buy, and what are the branches or sub-branches we need to have, and how much we can expand on that. And we need to write up these things. In a group project, like I said, brainstorming is very important. We have to discuss amongst ourselves, and also any decision making from construction onwards to purchasing, we have to include everybody. And we need to identify where we are starting in terms of knowledge and resources. Make a list of all things required and make a plan for acquiring this. And conduct research, whether that project is feasible in that area or not. Make a project timeline, because the project stays for a very long time, then everybody might lose interest. So you have to have a timeline to do this. And evaluate your priorities and plan your course of action. Schedule specific research time and plan daily, weekly, or monthly targets for your progress, like whether the electrical works have been done, whether instruments have been set accordingly, whether walls has been painted. Everything has to be scheduled, and it can be tracked with a free iPhone app also, or also other apps are available for tracking your time. Draft a project statement, which is everything has to be written down, the salient points, because it helps to make a good project, and which will be required for while applying for loans from the NBFCs or banks or some other parties. And while doing so, we can add visual like charts, pictures, and short videos, etc. So have you maintained, or have you fulfilled all the requirements for the hospital? Or have you made the OT walls paint, OT ceilings, or maybe the corridors, or maybe the OPDs? So everything we have to look into it and make adjustment accordingly along the way, because the things may not turn up as you want to be. However, when you go, you need to make adjustment, and if needed, additions need to be done. So you can buy your own, construct your own building, or you can lease an existing building, and always try to find a strategic location. And this always, it should be remembered that hospital must be easily accessible. A reception desk is a very important, and it should be located in a strategic position, and we should hire a accommodating receptionist. Consultant room should be spacious, and in the consultant room we should place all the required chairs, tables, desks, etc. And window or door must be sufficient, and it should natural light is an ideal thing for these setups. Facilities, modern equipment must be within standards and should be safe. Make sure the devices are up to date. Contract or coordinate with the suppliers of the facilities and other hospital needs. Having one supplier can save more, because when you order bulk equipment and supplies, you get a good discount. Management and marketing are also important thing. Coordinate with the local organization, local pharmacies, so that your hospital ideas or hospital news can spread to the local population. All the knowledge and licenses that has to be acquired. Also, the people you need to hire will need to have a clean background, and maintaining the reputation of the hospital is very important. We can also use while advertising smartphone based apps like Practo, Made India, etc. And also registering in these apps, we can manage our practice and we can get feedback from the patients. To conclude, starting a small hospital may require a certain amount of investment, but if you are really passionate, then you have to, if there is a great demand, you should go invest in the project. And need to have a well-constructed business plan that will guide you through all the needs of the business. An action plan is needed in all the steps in order to smoothly start, also to run a business, which is very important. Running a business is more important than setting up a business. Thank you.
Thank you, Dr.